I think if we perhaps start with Inotuzumab, it's well tolerated and it's quite easy to give as an outpatient. You can give it as outpatient therapy, but it has one major toxicity, and that's veno-occlusive disease. And if you have knowledge of the factors that are associated with veno-occlusive disease, it's actually possible to minimise those and to mitigate the risk. Perhaps the best paper about that is a paper by Kantarj in Lancet Hematology. I'm the last author of that paper, where we look at the risk factors, and these are quite simple things like avoiding dual alkylators and not giving, doing transplants or giving inotuzumab to people with abnormal liver function tests or significant past histories of liver disease. And then there are some quite sort of simple things like giving ursodeoxycholic acid to people prophylactically, and just watching their liver function tests really carefully and being prepared to stop or dose reduce inotuzumab should problems arise. So I think that's the main challenge with Inotuzumab. It's a therapy that gets nearly half the people to transplant. It increases the rate of them being MRD negative, and in the subset of patients who get to transplant, who go straight to transplant in remission, the results are really quite good. 51% 2-year survival. That's data from a paper that I'm the first author of in Biology of Blood and Marrow Transplant, published just last year. If we move on to Blinatumomab, I think this is a reasonably well-tolerated drug. There are some logistic challenges in delivering it. You do have to admit people for a few days when you give the initial dosing, when you increase the dose, but then it's more logistic. I think there is some neurotoxicity with Blinatumomab, and one has to be mindful of that. And in some people, there's a moderate instance of cytokine release syndrome, but it's nowhere near as bad as that seen after CAR T cells. The symposium doesn't specifically deal with CAR T cells in any depth, but of course CAR T cells bring their own challenges. You certainly need to be a very well set up specialist unit to deliver them. We do that, but it's taken a lot of time, a lot of effort. But they're a huge advance.